Thank you for taking the time to view this video. My name is Leon Robertson. I'm a professor adjunct at Yale University School of Public Health. This video is about research on the spread of COVID-19, much of which has not been reported in the news media. You can download the book, seen here, in which the research is reported in more detail. In November 2020, while watching the lengthening lines at COVID-19 test sites on television, I thought, if those people test negative, they're going to Grandma's house for Thanksgiving, and some will get infected before they arrive and pass it on. I found data to test the hypothesis, and the data supported it. Not only was it supported by data on cases and hospitalizations in the United States, other countries had an on-demand testing policy, also had more cases and hospitalizations after increases in negative tests. The problem was not confined to holidays. Earlier, I did research on the geographic distribution of cases and the effect of shutdowns on the spread of the virus. This slide shows that at the end of May 2020, reported cases were highly concentrated in only 200 counties of the 3,141 counties in the United States. A substantial proportion occurred in just 25 densely populated counties. Yet the shutdowns were imposed on people whether they lived in counties with a lot of cases or not. Many had none at the time. The concentrations of cases and deaths in the high-rate counties were related to crowding in homes, workplaces, and religious congregations, as well as economic and demographic characteristics. Adjusting for these factors statistically, the shutdowns in the spring of 2020 reduced cases and deaths about 55%, below what one would have expected. But shutdowns in low-risk areas increased political resistance to other countermeasures, such as distancing, mask use, and vaccines. I looked worldwide for countries that had democratic governments but had low COVID-19 death rates to see how they contained the virus. Of the 7 countries that qualified, only 2 had imposed shutdowns. A common theme among them was respect for science and willingness of the population to follow public health recommendations to physically distance, wear masks, and quarantine if asked or required to do so. Slovakia is a democratic country that was a candidate for countries that did well until the fall of 2020. It was praised in articles in the journal Science and in Foreign Policy magazine for its policies. From March to October 2020, Slovakia tested only the symptomatic, old people, and those with pre-existing conditions that made them more vulnerable to severe results of infection. Then Slovakia changed to mass testing. A disaster ensued. During March through September 2020, less than 1 million tests were administered in Slovakia, during which it had a death rate comparable to the other democratic countries with low rates. In the next 6 months, Slovakia processed more than 38 million tests. Cases and deaths spiraled out of control, and the death rate jumped to 48 times its March to October rate. At the time I saw the lines of people waiting to be tested in the United States, I was unaware of the Slovakian experience, but it fits my hypothesis of what was happening in the United States. Only 2 of the democratic countries that I mentioned allowed on-demand testing, Iceland and South Korea. The difference is that they were successful in tracing and quarantining cases. Iceland, for example, required those who tested positive to be quarantined in a hotel away from their families for 14 days. The advocates of large-scale testing assumed that if contacts of those who tested positive were traced and quarantined, the spread of the virus would be slowed. They did not account for the possibility that people would not cooperate. A study by the Centers for Disease Control in collaboration with local health departments in the United States found that contact tracing based on positive tests largely failed. Tracing and quarantine occurred for less than 10% of the positive cases. The study was published online by the Journal of the American Medical Association, but was largely ignored by the news media. To further examine the correlation of negative test results and spreading infections, I downloaded data on testing and subsequent COVID-19 hospitalizations in 27 countries and 48 U.S. states where the data were available. When the number of negative tests increased, 2 weeks later the number of COVID-19 cases and hospitalizations increased, and when negative tests declined, the subsequent cases and hospitalizations declined. While one would expect more cases to be found if more tests occurred, they should show up in the data right away, not after the incubation period of 2 weeks. And more testing should have no effect on increases in severity as indicated by hospitalizations and deaths. The data support the hypothesis that people who received negative tests were traveling and visiting, pick up the virus in the process. This slide shows the trend in negative tests, COVID-19 deaths, and vaccinations in the United States. During the shutdowns in the spring of 2020, deaths declined while testing increased, but thereafter, fluctuations in deaths tended to follow the fluctuations in negative tests. Because deaths can occur from a few days to several weeks after infection, and other factors have an effect, the correlation is not perfect, but it is consistent with the hypothesis that the virus was spread by people who tested negative and thought they were okay to travel and visit. Notice in 2021 that the deaths plunged when vaccinations increased, along with declines in negative tests. But when vaccinations slowed down and the negative tests increased in the summer of 2021, the fourth surge in deaths followed. One of the other factors inhibiting control of the virus is politics. Resistance to physical distancing, mask wearing, and vaccines is partly a function of political ideologies, as well as false claims on Fox News and social media that they are ineffective. From March until he lost the election in November 2020, President Trump contradicted his scientific advisors in press briefings, on Twitter, and at political rallies. He promoted ineffective treatments. He encouraged resistance to lockdowns, mandatory physical distancing, and mask wearing. At his rallies and White House events, most of the attendees were without masks and in close proximity. Trump, as well as many of his staff and his protectors in the Secret Service, were infected with the virus. Several researchers found that most of his followers were not in compliance with public health recommendations. To see if the testing effect and the political effect were correlated, I examined data from 217 U.S. counties where data on all the variables were available, adjusting statistically for crowding and other variables that I found significant in my first study mentioned earlier. The COVID-19 death rates in the counties were higher in relation to the percent of Trump votes in the 2016 election, and higher in counties that had more negative tests. The effects were independent of one another. Both were highly predictive of the death rates. Politics also apparently the effective effort to get people vaccinated. As this slide shows, on average, the vaccination rates in U.S. counties with a high percent of votes for Trump in 2020 are about half of the vaccination rates in counties where Trump received a substantial minority of votes. There's a lot of scatter in the graph indicating that other factors are involved as well, but many Trump voters are resistant to being vaccinated, allowing the virus to spread. More virus spread means more mutations that could be deadlier than the current strains. The testing problem continues as well. Testing people who care for the vulnerable or in other workplaces and schools may reduce exposure to the virus, but the Biden administration plans to spend $2 billion to subsidize home testing. If people behave as they did in the past after receiving a negative test, that does not bode well for the 2021 holiday season. Testing is unnecessary unless you have been exposed to someone with COVID-19, feel sick, or must do so for work or school. We can reduce the spread of COVID-19 by getting vaccinated, wearing masks, and avoiding contacts with people who refuse to do so. People who claim that they should be free to do so are ignoring their responsibility to their families, friends, and communities. You can download the book free or buy a hard copy at www.nanlee.net. Again, thank you for watching. If you've not been vaccinated, now would be a good time. Like the book, it is free.